Welcome to this week's weekly Wednesday webinar. I'm going to give us 30 people just to rush in and see if they've got a chance to log on. There are lots of other AI-related meetings going on in the faculty this morning, so I think people are tied up between them. So I'm just going to give us a couple more seconds.
Hello, Shirra. Can I stop sharing the screen?
Yes, thanks so much, Malusi. Go ahead. Okay. And in fact, I will then share my screen, which should get everybody going. Okay, everybody. Malusi, you'll tell me if you can't see or you can't hear me. You're in charge of making sure that we are still audible by the end of the session and that everybody can see what I think they can see, which is the slide deck that we're going to be talking about today. So welcome, everybody, and thanks for joining us. I am aware that a lot of the education-interested people in the faculty this week are attending the SAHI conference, which is the South African Association of Healthcare Educators, and is probably a wonderful format for people to share their education style ideas relating to formal research or informal research or just experiences. So it's something that you should consider attending if you haven't ever been there before. In line with SAHI as being our national association, there is also an international association of medical educators, which the acronym turns out to be AMEE, A-M-E-E. And AMEE is an international group that speaks about healthcare education as its principal data. So in other words, when people ask, what is your primary research? If you're researching health professions education, AMEE is the conference to go to. So the reason I'm explaining all of that is because over the last couple of years, well, let me take one step back. AMEE showcases a set of guidelines that they publish in their journal Medical Teacher. And the guidelines cross the gamut of health professions education, from types of pedagogies to curriculum design to assessment design. And so over the years, there have been very many AMEE guides. But certainly over the last year, we've been seeing AMEE guides now that relate to use of AI in health professions education. And because of that, I thought it would be useful for you to see what the international literature is saying, and then try and relate it back to our own specific contexts. So I don't know if you managed to download them, but on the invitation that was sent out for this week, we added links to 4 journal articles. These are they. If we take them in number order, there was the AMEE Guide number 156, which speaks about use of AI in medical education research. So the types of things that you can use AI for and how that relates specifically to research in medical education. It was followed closely, and one assumes that there was competition in the order of publication with the guide number 158, which was use of AI in health professions education, specifically talking about ethical use. So what kinds of data you can use and what kinds of inferences you can make when you're using that. Then coming back mysteriously to guide number 172, and that is preparing for artificial general intelligence, which is something that hasn't happened yet in health professions education. So we'll spend a bit of time talking about that. And then the latest one, which I'm sure is not going to be the last one, and that is in their series AI in health professions education, looking at assessment. So my first question to all of you is, did anybody manage to download the articles, even if you haven't read them? Or Has anybody had a chance to read them and see what the articles were about? I do have the chat open, so you can share with me in the chat. I'm cool if you say no also. I just need to know that you're alive on the other end of the screen. Thanks, Ildi. Yeah. Let's read that. Okay. All right. So I mean, for us, I think it's an important conversation. At the moment, our university is looking at university-wide guideline on AI use. And of course, our faculty in parallel is doing the same thing. But my sense at the moment, especially from these webinars, is that it's pretty much a free-for-all out there. Like everyone's doing their own thing. And I want to see a thumbs up or a heart or something if people agree with that statement, or if they do think, if they do think that, yeah, exactly. So I'm really excited to see Gavin's join the meeting, because I was in the meeting like 5 minutes ago with him, where they were discussing the use of note takers, and if there's any way to control if a student sitting in class uses a note taker, and then all of the content, including maybe their own credentials, etc., could be available to, the wider world as we live in it. Has anybody had that phenomenon? Anybody had that discussion with students? Not yet. Back in the day, students used to have to ask a lecturer's permission to record lecture. So they had, especially in the medical program, they had their recording situation captured in the lecture theatres, and the class rep would come at the beginning of the lecture and say, do you mind if we record you to make a podcast? And there were some lecturers who said no. But even if that was the case, nowadays with smartphones or other devices, anybody can record anything, including video. And a lot of them don't ask, because it's viewed as, if it's my device, then it's my data. But in actual fact, I think that's something that's certainly could be discussed. So I bet you that's something we don't really think about when we're putting together what we're now talking about, is designing learning experiences and incorporating AI into that students can have a whole different take on how all of that is used. So that was the idea, to look at the kinds of things that are now in the international literature in health science education, and to try and see just how applicable they are to our particular situation. So I did set some objectives, but I think they're very high level. And that is, we need to look at some definitions. Again, I think people are still very confused. And now that they're bringing in this new terminology of something that's not yet here, this artificial general intelligence, I think we need to be quite clear on which one we're speaking about. I think there are a whole lot of opportunities for us here, and we should be thinking about how that opportunity translates into action for us. But there are also obviously ethical considerations and advice on best practices. We need to think about AI in research, and I think that that's a difficult area for us, because traditionally our research practices involve writing, and at this point in time, and I'm not sure how it will translate, but at this point in time, there is no legal way of saying that a student used AI in their writing, even though as supervisors, many of us can pick it up straight away. So that's a conversation to negotiate. And then also the use of AI in assessments. A couple of weeks ago, we had Prof. Kravadia showing us his AI agent that helped him to create MCQs. So that's one idea, but the concept of big data, AI in OSCEs, comparing student data, that kind of thing also speaks to us as something that people may be doing, and maybe that we should have guidelines, or as they say, guardrails for what it is that we do with AI in assessment. And lastly, this is a place where we can really contribute to the strategies in our faculty and in the institution about how it is that we are using AI and think AI could be used. So there are a whole lot of really knowledgeable people out there who are thinking about all the what ifs, but there are a whole lot of standard you and I kind of people out there who think, oh, I've seen this as quite a good idea. Maybe I can just implement it for myself right now. And so we want to be able to bridge the gap between those two kinds of people with some guidelines as to how it is that we're using AI. All right, we've had this conversation before, but I think it's important to underscore. Why are we talking about this? Not just because it's available to us now, but healthcare and health systems. It's a field where the adoption of AI has been very rapid. And also, if you don't use AI, or if you haven't heard about AI use, then suddenly you're told you're behind, you're not keeping up. And so I think it's important to know what we're keeping up with and what the expectations could be. And lastly, we don't want our graduates just to be good technicians. Okay, we spoke a few weeks ago about being and becoming, like what kind of healthcare practitioners do we want working in the healthcare sector? And we want compassionate people, we want people who care, we want people who are curious and are able to pull in information from really different places. And because those are the kinds of people that we want, it's not adequate for us to graduate students who are great users of tech, but actually can't think beyond that. And I think that is the challenge of AI use in academia at all. And that challenge, saying that we want more than just good technicians, is something that I think will be pervasive across the sector. But I really feel in health science education, it's one of the key things that we need to be working on, is how do we help our students to become fantastic human beings as health science practitioners, rather than getting the correct answer the first time, or finding an answer and saying that is definitive, because people are people and there's never one right answer when you're dealing with people, right? I'm cool if you want to put up your hands and tell me you don't agree with me, or drop something in the chat. But those are principles that I think speak to why it's really important to look at what other people are doing, and also to try and contextualize it for ourselves. So let's go back to the definitions. And now I'm taking these straight out of the 4 papers that I did give you to have a look at. So I'm sure there are a billion other definitions, but this is the way they're defining it in their discussion. What are they seeing as AI? So computer systems that require human, and I'd say like intelligence, so things like pattern recognition, voice recognition, decision-making in the context of looking at algorithms, and also looking at the risk-taking behavior of which decision they've seen in the data set come out one way or another. So if anybody's got another definition of AI that speaks to them better, let's see how we can compare that to the ways that they've been used in the paper. The distinction between a large language model and like something like ChatGPT or Claude or any one of those is that it's a subtype of AI, and basically it's predictive. In other words, what are the kinds of things that come together in text? And it's supposed to generate a sort of human-like response. And the problem with that is people tend to anthropomorphize it. Wow, nice word, hey? To take something that is inanimate and ascribe human feelings and thoughts to it. So although it responds to us like another person, we have to really bear in mind that it's really not. And a step back, if we look at machine learning, which is also another subset of artificial intelligence, that can be quite scary, because it's I would say, precursor to the AGI, in that it's it's a set of algorithms that can learn from the data that it's being fed. So it can make other predictions from data over and above the things that you've asked, and it doesn't have to be explicitly programmed for each task. So it can give you a whole lot of information on a data set of things that you never even thought about. Or maybe you did think about it, but haven't asked about it yet. So that's been used extensively in research. And I think that it's something that we need to keep our eye on in relation to health professions education. And lastly, the prospect of artificial general intelligence. We still don't have it. So predicting into the future, and that's why I was really surprised that they produced a guide on it in the AMEE Guides, because it's predictive. Because it's not here, they're saying, how would we be using this and what would we be looking out for once we have accessibility to it? So artificial general intelligence, and I'm thinking we're going to have to come up with different ways of labeling what kind of AI we're talking about. It's supposed to, they think, will have like a human level of adaptability, and it will be able to make connections way over and above the large language models that we currently use, and also predictive of data sets that you feed it. So, for example, at the moment, Elsevier is working very hard to tell us that their clinical key AI is probably the best thing that any healthcare practitioner could use, because it has the Elsevier data set. So all their textbooks and journals and expert reviews, etc. And when you ask it a clinical question, it will retrieve its answer from that data set. So it's protected knowledge, and it's already knowledge in the domain, and it's supposed to be safe knowledge. And so they're saying, if you want bedside notes or you're going to check on a bedside answer, that's the tool you should be using. Now with artificial general intelligence, the claim is that the AI would be able to rank. Instead of just retrieving information, it would be able to say the most likely thing and also give you answers for questions you haven't asked. Who's scared of that? Hearts, thumbs up. Nobody's scared. Everyone thinks it's great.
Yes, we are scared.
Lizette, it is daunting. And it takes us back to like all those science fiction writers of the 1940s who wrote about intelligent robots, you know, and positronic brains, and being able to make the connections even faster than a human being could, but the same way that a human being does. And yeah, I'm not commenting on the tech, but the idea is that that is something that is in the very near future. And because of that, I think we need to think about they call them the guardrails, the things that give us the boundaries of what's permissible, and how it is that our students could be using these kinds of assistances, and how we can build in training students to be able to, on the one hand, use it and use it sensibly, but on the other hand, not to lose our own humanity, to be able to still look at a whole lot of data and make considered decision on the basis of it. And also to be able to make decisions in the face of uncertainty, because maybe for humans, we will be less certain than these huge data sets that can actually access absolutely anything that's out there. And where is the space for intuition and the space for, you know, type 1 thinking, which is the gut response when you see something and you know in your gut that there is something going on here that maybe an AI would not be able to pick up. Yeah, so I definitely think that those are attributes that we need to encourage in students, although it's a moot discussion because it makes it really difficult to be able to differentiate for the student what is a good human response versus what is an accurate machine response. And that's part of the ethical discussion I think that they have. Janelle?
Yes, good morning, everybody. If I can just come in there, it's really a great concern recently. I had a student coming to me and we spoke about she was missing quite a lot of clinical allocations. And when I asked her about it, she said, well, she feels quite incompetent in the clinical area. And yet, when I look at her work that she submits, she's actually a high performing student. But then I did go into and ask her, okay, and I think the reason the prompt for having this discussion, I could see she was using AI in her submissions. So I prompted her further. I'd asked her then, how do you complete your assignments? How do you learn? And she was quite open with me saying she uses AI, she uses ChatGPT, she uses quite a lot of platforms to access, and it gives her these beautiful answers, but she's unable to actually then go into the clinical area and actually implement or be a clinician. She feels incompetent. So there's a huge barrier I'm seeing with, or a huge gap between students that are developing. They can seem, and they might think they have the knowledge, or they think they're doing good, they're getting good marks, but unfortunately when it comes to practice, they are lacking in their practical knowledge about implementing what they are reading.
That's very concerning, isn't it? And it makes me take a step back and think, okay, how are we actually assessing our students? So before, there used to be these discussions of the theory-practice divide, which health professions education is now saying is something that really could be bridged, if you like. Yes, there is a body of theory that people should know in order to practice safely, but at the same time, a lot of it revolves around student performance in the clinical arena, if we're talking about that, or in the laboratory, if we're talking about that area. And there is no substitute for learning in that environment, because that's how you enculturate. It's how you become, as we speak about, a healthcare practitioner. So if our assessments are saying this is a good student because they're providing good answers or good one right answers, then how are we incentivizing them to participate in the workplace-based learning that it is that we want them to accomplish? So I'm going to give you that question now to think about, because one of the things that the article on assessment that we're getting to now spoke about was, making assessments more appropriate for the environment that the students are in. And what does that mean in our context? We have incredibly busy environments. We have really busy clinical environments, and often students are in there and are given tutorials, but they're not given the time to spend, for example, with patients in some circumstances, and in other circumstances, when they are given that opportunity, as Janelle says, they are scared of it because they don't have what they feel is the support. So let me give that to you as an idea to think about. In terms of student assessment as you currently do it, first of all, where are the opportunities for students to use AI? And second of all, are we getting an accurate picture of the student's competence if there are parts of our assessment where students could be using AI? So the question again, where in your assessment do you think students are using AI? Let's take that part first. As Janelle says, she's had students who have to submit written responses, and it's clear that they've used it. Robin, do you guys use a lot of essays?
Hi, Shirra, sorry. Yes, especially for our honours class, because we really feel that in the undergraduate space, they don't have enough exposure at all to writing science. So we try and do quite a lot in terms of writing. And now with their essays, yeah, not all of them, but some of them, you can see it. It's not only the wording that you can recognize, it's the fact that there's no cohesion and flow. It's bits and pieces of things that they then just kind of mosaic together with no structure.
So I think you've identified really a weakness in our faculty. Two things. First of all, in our undergraduate spaces, there's very little writing as communication. Certain courses have worked on it, it's true, but across the board as a generalization, I'd say you're correct, which then leaves our postgraduate students really vulnerable because it's a skill that they haven't developed from first year. They haven't learnt about, constructing an argument in writing or putting forward a point of view or anything remotely concerned about that. As Ashmita says, looking at a literature review where you are integrating ideas and not just doing your shopping list of papers that you read. So those are huge challenges to our postgrad students. Honours probably the most of all, but certainly at a master's level, I'm seeing a lot of that as well. And so, how do we then set the assessment so that they can use the AI to assist them? So as that assistive tool, but learn to go beyond it. And I see also, so for prac reports, and that's also part of it, do you want a written prac report at the end of the prac so they can be just adding their notes as they go, or do they then have to submit it and then you're going to see a lot of generated stuff with their numbers punched in maybe? So the question I think we need to go back to is then, what are we asking our students to do? So instead of just saying, okay, there are look up, I want you to find, so your first task is to find 15 papers on your topic. And then your next task is to integrate those 15 papers into a literature review. What other approaches could we take that would make the use of AI assistive rather than not the kind of output that we want the students to work with? Rowan, go ahead.
Not my idea, but Monica in our division, she gave the students the task of asking AI to write an essay on topic X, and then the student's job was to critique the AI essay, and that's what she marked them on.
Yeah, so it's a nice idea to be able to get the students to understand the parameters of what the task was sufficient to be able to mark whatever, a peer or what AI produces. And it's really a good idea to be able to help students understand the level and also the criteria that it is that you're looking for. So that's a great idea. Another idea might be to have several waypoints along the way. So instead of saying just write a literature review, say construct the criteria, the points that you're going to raise from all of these papers, and say which papers contribute to which criterion. So to help them understand that they are not now just going to give a summary of papers, they're going to look at hypotheses, or they're going to look at specific data points and then see which papers speak about which in the argument. But that then needs, and here we come to the point of the guide number 158, which is that you need to be able to be giving really good feedback to a student so that they then understand further the things that they need to be able to do. So if they are going to group the papers, then the next step would be, okay, now write each paragraph and let's see how you've grouped the papers and if that's sufficient for putting the literature review together. So in other words, more waypoints along the way, which raises the question for us, do we have capacity to do that? Do we have time in our lives to be able to have 3 waypoints along the way before a student produces a literature review? I mean, I'd hazard to say we don't. And if we don't, then how do we redesign assessment ourselves using AI to assist us in giving feedback to students? And I think that this is where our challenge is. What are students doing? What could we be doing? Okay. Janelle, go ahead.
Shirra, I just want to add here on that point, how can we make sure the student understands the work? Because ultimately we want them to understand the work. We want to show that they understand the work, that they've not only accessed AI and given you a lovely literature review. So recently with our undergrad students, what I did ask them to source resources and write me a literature review, which they did. But then I asked them to present a voice-over PowerPoint of their literature review. And to encourage them to, I wanted to see, do they understand it? And I thought, and that the voiceover PowerPoints were really well done. I could see they used AI, but then they had to construct it in a way that and present it. So I thought that was a way, that might be a way of forcing the students to incorporate, or maybe to present the information that they had obtained, and to maybe prove that they understand it.
That's very comprehensive. I want to know if anybody else has used something like that in what they're doing. And I do want you to excuse me for 1 second. I have somebody at my door and there is nobody else on the floor. So I am going to, I may just fade out for a second, but I'm interested to know if anybody else has had an opportunity like Janelle just described.
I think go ahead, Azal. Sorry.
Please do.
I was just wondering, and it might be me being old school, but our honours also used lots of AI, like you said before, to write lovely protocols and proposals. But I got the impression that it took them away from reading the original articles, and it limited them in having an opportunity to expand their knowledge base. And I think if you're a student, you want to do stuff as quickly as possible and go and socialize at night. We were all young, so I can totally associate myself with that. And I'm just worried that some of these things like protocols and assays take a great learning opportunity to acquire knowledge away from students.
So I like the idea of you talking about learning opportunities, you know, as being the work that we used to give students. And I think that's something that, as we speak about in the faculty, we have to kind of work on as what will the student learn from this activity that I've given them? If you have a look at, I took a timeline from all the papers and said that probably the key issue for us was 2022. With the advent of this sort of AI that can talk back to you. And now we've reached the point where people are using, you know, all the metaphors. So people say, well, we got used to calculators and people can still do things with numbers. I don't think it's quite the same thing. So I think it's a simplistic metaphor to be able to say it's just a tool. I think it's something that will have to help us to reevaluate exactly where we're coming from. So I'm just interested in the mix of the papers that that AMEE has put together at this point. Because the obvious one is ethics, right? So we'll talk about that shortly. But assessment and research, although they're in the general newspaper saying, have a look at, pedagogical concepts and things. Yeah, technology is not pedagogy, so you still have to have a good reason for teaching the things you're teaching. It's not okay just to say, use AI to just find some content and that's your lesson. But at the same time, we need to be looking at the big areas where AI could be making a difference in not only what our students are doing, but in the kinds of ways that we think, that we feel that students are developing. So yeah, I like your discussion about what is the learning opportunity for the student, bearing in mind that they say they don't want to have a lot of time. And people look for shortcuts. So I'm interested to know your opinions, everybody, about those papers that AMEE has already written up, and what would you like to see specifically about the AI use in health professions education that we could suggest to AMEE that we need a guide on, or we could write our own guide and send it through to AMEE. Like I said, they took probably the big three: ethical use, number one, assessments, and then research. And then they dived off into this speculative artificial general intelligence. And you see they gave the data 2027 to around about 2034, assuming that it'll just get better and better. I'm going to go back and see, because I checked right at the beginning before people managed to join the session. But I'm just interested to know if anybody did manage to have a look at that artificial general intelligence paper. Anybody had a chance? Okay. So then maybe what I'll do, not literature review style, is just go through the 4 papers that we did add as the NIC and give you a brief overview of what it was they were saying. So from our perspective, the one where I think that we've got the most control as lecturers ourselves to change the types of assessments that we set our students. Let's look at the assessment guide, which was actually the latest one, the guide number 178. So their position is without a doubt that AI does disrupt assessment. We can't go with the assessment as usual idea, particularly if the assessments involve straight writing. And what they're suggesting is that we start rethinking the kinds of things we want students to demonstrate for us as being competence, compared with the assessments as usual that we used to have. So they're even going so far as to suggest that MCQs as a test of content knowledge is, I'll be polite and say, pedestrian. And that the ways that we ought to be thinking about assessing our students, which is very daunting, I think, from our perspective, where keeping going with what we currently do is something that is taking all our energy and effort. So to go over and above and redesign assessment is worrying. But one of the things that I would think about is we've shifted now towards understanding the concept of blended learning and what students do in terms of the time on task. And so as part of that development, in thinking about redesigning how your curriculum is actually developed and presented, it's a good opportunity to speak to the design team about redesigning assessment and ways that you could look at part task competence versus whole task competence, and helping students to understand where their problems are and also where their strengths are. And if we view assessment as that, as a way to show students where they're succeeding and where they're not, just like Janelle said to the students, you've given me really good written answers, but does that mean you can do anything? That's the conversation that we would need to have. And of course, so the paper 178 comes back to the idea that feedback is really important. And also helping students to understand what the level is, what's required. So the rules of recognition, they say, what the assessment is going to be and what they actually need to show they can do. And that speaks obviously also to each student individually. So the suggestion is that we use AI as part of developing the ways that we can deal with students in a personalized way, which I guess is yes, a big ask in our context, but certainly ways that we can start introducing those kinds of ideas, I think, are important. And then they give examples in the paper, which we've already kind of engaged with in the webinar. For example, the real-time feedback on clinical reasoning, like what Prof. Kuwati is doing with his students, history taking, and then in a practical sense for lecturers, AI-assisted OSCE scoring. Wouldn't that be cool? And they're still saying with human oversight, but the prediction is maybe not eventually. And then the idea of using AI in not only designing, but in using, making the data points for programmatic assessment, which is something that we could look at aligning for not only developing things like EPAs, where you have lots of competencies viewed as one real entrustment point for a student, but collecting that individual data. Yeah, so Ashmita, there is a recommended statement that Faculty of Science is now using for their students when submitting an assignment. I can get that wording for you if you're interested, but I definitely think that we should do that with our students. You know, like there's that plagiarism declaration on the front of an assignment that they wrote a while ago. So I think acknowledging the use of AI, and they've even got a format of how you would reference the use of that AI, is important for students to do. Particularly since they have to know that we can see it. You know, they should not think that because they've submitted something which says the same thing 3 times in one paragraph using different words is going to be acceptable, and that they should be able to justify the kind of endpoint that they reach because of the AI that they used. Okay, so I don't think that paper 178 was bringing up anything different from our particular context in using AI as a tool in developing better assessment thinking and better assessment practices in health science education. And I'm wondering whether the lab-based kind of education is something that is bothering people with thinking about different assessments, or is it just, again, link between theory that students are asked and then practice that they're having to demonstrate as being, I was going to say, a key point of difficulty in bridging the two. So people working in a lab space, is AI bothering you in terms of the assessments that your students are doing? Not really. So Chloe, to come to your question in the chat, yeah, there are statements that have been put together. I said right at the beginning of this week's webinar that the faculty is working on a set of guardrails, if you like, suggestions and guidelines on how it is that AI can be used. And last week, Jean-Luc did spend quite a lot of time telling us that the reason why Copilot is useful to us, even if it is clunkier than some of the others, is that our data is ring-fenced. So if you've got all of those highly problematic situations where students are wanting a case report and they upload individual patient information, that's not going out into the wider universe, and that we are being POPIA compliant, and that the students understand the ethical implications of that. So yeah, I think a statement is a really good idea, and although there are guidelines out there for our specific faculty, I think they're going to be coming soon. Gavin, we'll wait on that, but you can see that there really is a need for giving people at least that. What statement should students be using, and how they're actually going to acknowledge what the use is. So let's move off the assessment idea and spend just the last few minutes talking about this concept of AGI. So first of all, before talking about it in this webinar, I want to know if anybody had even heard of it. You can wave or clap or something if you did. Yeah. So I'm still mystified as to why they wrote a whole guide about it, because maybe it's just in preparation for. And so the paper then deals with, and this is my summary, so you have to take it as gospel. I'd be really interested for you to read it and come up with your own. And that is, there is enthusiasm for the idea. I mean, people see it as the world developing, no, but there's also a large amount of fear. What is it that students would be able to do with this? And number one, on the one hand, on the other hand, how dangerous is it for the world to be dominated by machines that think better than people? Again, that Isaac Asimov idea of you have to program into the machine straight away, first do no harm, you can't harm anybody, or by inaction cause somebody to come to harm, all of those ideas. So how in this day and age are those things embedded into a more human-like AI? And again, the idea that even though it's machine driven intelligence, how do we stop dealing with those people feeling that the machine then is a person and can respond even better than a person? The third leads to the ethical considerations, and in the paper on ethics that the AMEE guideline put out, I think a huge part of it was saying that we do have to completely acknowledge that the AIs that we're using are biased. If I hark back to our 2023 speaker at our focus day, Professor Bukosi, his whole concept was the use of AI in breaking social justice norms, and how it is that we can make AI more equitable. So what we're saying is that the kinds of answers our students are getting are biased. And one of the exercises you could do is to, again, critique. Yeah, Robin, as you said, in your department they did, but have a look at the kinds of information that the AI is giving and try and critique it. What's wrong with this? Is it given from what kind of perspective is the information being given from? And how would it be better? How could we mitigate the kind of bias that we're seeing? I think students don't often think of the bias of the information. They're just saying it's this huge data set. Yeah, but where does the data come from? And what's the approach of it? And people were saying the more that we use it in the global south, the more that kind of data into the system. I'm not sure that it's just the data. I think it's the take on how the data is used. And that's something that we're going to have to work on. And then finally, in the guide, the 178 guide, so the author's recommendation is that we need to frame the use of the AI So yes, acknowledge, and there must be statements of where you've used AI and referencing it correctly. But what he's trying to say is that the AI can't replace a human tutor, which I'm interested in because we are using even the AI that we currently have in that capacity because we don't have sufficient resources. So if we're saying even a generalized statement, when you use Uwazi, our reference manager, and you give the students a quiz, there's a space for saying why the question's right or why the question's wrong in feedback to the student. And that itself, by just putting it in once, all the students will get the feedback, and then you can have grade feedback on, you know, if a student gets between 20 and 40%, what comment are they going to get? And if they get between 40 and 52%, what comments are they going to get? So even using those is a kind of graded feedback, which is useful for student learning ultimately. And I'm not going to ask you how many of you use that Uwazi feedback because it's there and it's a tool that we can actually all be using, which is slightly more than a mark, because in unfortunately marks-driven faculty, the marks are what gives the students their idea of their competence. And maybe the whole point about all of these discussions is to move students away from that idea and to move them more towards, as we say, a culture of becoming a great health practitioner rather than the person who scored the highest marks on every test. And maybe the idea of using the AI is because they feel like they'll lose the competitive advantage if they're not using it. And that then furthers our divide, where we know that people don't have access, don't have electricity, don't actually have the repetitive practice time to improve, for example, their prompt engineering. And that then all comes out in the kinds of work that we're seeing now that students are submitting. So I'm going to take a step back and say, it was really interesting to see that AMEE, as an international medical association, is looking at the use of AI and producing guides already on the use of AI in health professions education. But I also feel that these guides are incredibly general. They're not giving us useful hands-on suggestions of what we could do. It's very much a very high-level kind of list of suggestions. And I do think that in our context, we can produce something a lot more targeted and a lot more meaningful to us in giving out guidelines to not only our own faculty, but actually maybe to health professions educators, certainly across our continent and maybe applicable elsewhere. So there's a nice opportunity for those of you who do have had a chance to go and look at the articles and see that maybe that's a target that we should be looking at, is deriving our own AMEE guide in our own context and sending it out for other people to view. So that's my challenge to you for this Wednesday. And we look forward to more discussions in the following Wednesdays to come. I want to know if I've given you sufficient overview of the papers for those of you who have not had a chance to look at them. But it certainly generates the kinds of conversations that we already have been having. And yeah, I do encourage you to go and look at them. If you click on the QR code in the invitation to this week's webinar, you will find all 4 papers. But if you just feel like using the AI construct that Google now offers you, AMEE Guide 178, 172, 158, and 156. And you might see lots of other AMEE guides there that could be useful to you in the interim. So go and have a look. I'm happy to answer any questions. Gavin, go ahead.
Thanks, Shirra. Just to answer some, obviously, queries about the faculty having those guidelines or perhaps a statement for students to include a declaration of use of AI. I was thinking of perhaps including the close to finalized report statement in the chat for people to use, perhaps. It is just at one more level of approval at the higher levels, but I think it's close to being good to go. So perhaps I'm going to share it now. Just my computer's being a little bit slow.
Okay.
So
That would be
people can use
brilliant.
it.
So if Gavin drops that in the chat for us, that would be absolutely amazing. If it's close to acceptance at our higher levels, that means that it's something that we can introduce to our students now, and that will answer, the types of things that we're wanting students to be able to declare when they're handing in their work. So as soon as Gavin finds it, he'll drop it in the chat. Anybody else got questions this week? And I do want to know if you feel that it's a valuable idea to be talking about papers that other people are writing about AI, or if you think that these Wednesdays should be more hands-on and how-to sessions rather than looking at a high-level idea. So happy for you to drop your idea in the chat, or to open your mic and tell us, or to drop me an email during the week as well. Super, Gavin, thank you. I see the statement there. It's a Word document and available for any of you to download for use now with your students. That's perfect. Right. I'm going to wish you all a happy Wednesday and see you next week. Thanks for joining us.